know we'll be getting a few more people joining us, but let's try to stay on time. First of all, welcome to everybody who's participating in this Central Minnesota Senate Forum. It's the first time we've done this, and we invited the senator candidates from all the Central Minnesota districts, which are Senate District 13, 14, and 15. I'm Kris Sundberg. I'm Executive Director of Elder Voice Family Advocates, and we are a group of residents who live in long-term care facilities, their families, professionals, and others who are concerned about the care given to elders who reside in these facilities. Our state legislators, part of what we have learned is how critically important our legislators are. They make many of the policies and regulations that the long-term care industry conducts its business. So thank you for our senators and Senate candidates who are joining us today. This is going to be recorded, so you'll be able to share this with anybody else you wish in your families, in your networks out there. Usually it takes about 24 hours to get it posted. We'll ask that you hold your questions to the end and let the candidates make their comments, and also use the chat box to let me know what your question is, and then I will read those and direct them accordingly when each of the four people have made their comments. Who we have here are Senator Jerry Ralph from Senate District 14, thank you, and his opponent, Eric Putnam. And then we have from Senate District 15, Senator Andrew Matthew, and his opponent, Brent Kris. Thanks so much for all of you coming. The two, Senator Howe and his opponent, Michael Williamson, were not able to participate today. What I'm going to do is ask that each candidate just tell us a little bit about who you are, why you're running, and then address the four questions that we posed to you. And that was, what are your views on improving care in senior living facilities, reducing abuse, neglect, and exploitation, addressing staffing challenges, and providing a livable wage. I'll ask that you keep your comments to about 10 minutes so we have enough time for Q&A. And we'll start with Senator Matthews and let him make his statement, and then we will ask Brent Kris, his challenger, to follow him. So Senator Matthews, you have the floor.
Am I off mute now? Am I off mute now?
You're off mute. Thank you. Go ahead.
Perfect. Well, thank you, Kris. Thank you for having me. Thanks for being flexible. Sorry for the schedule on my end. Got really busy this afternoon, juggling multiple things here, but I wanted to make sure that I caught this and spent time to talk with you all. So thank you so much for sponsoring this forum. I'm Andrew Matthews. I've had the privilege of serving Senate District 15 for the last 4 years. I've been a resident in the Princeton-Malacca area for nearly 25 years, and been very involved around the community, and it's been a privilege to serve in St. Paul, where we're standing for our rights, our freedoms, and we're trying to do what's right for the state of Minnesota, including our seniors and those that are in long-term care. So I've been able to build good relationships both before and in the legislature, and it's been a privilege to work with you all as we have tried to make things better in our senior care facilities. So I am glad to have supported the elder protection bill that the Senate helped pass in 2019 that included a lot of significant reforms to help Minnesota's seniors, help them be able to use electronic monitoring devices in their rooms. It allowed them to have protections against retaliation for residents and their employees in nursing homes and their facilities. It established a license framework for licensing our assisted living facilities, and it gave more funding to get these new licensing and regulatory activities in. And I know it was it was a step in the right direction. I know there's more areas that we're still trying to work on, that we're still going to bring back up next year. I know that elder care worked with legislators, and there's still more issues that we want to get done, but we've been able to make a start, and I've been glad to do that. I think that our senior care has really faced some pretty strong challenges this year with COVID-19 now impacting all of us, and it's hit our seniors and our elderly in pretty severe ways. And I have been among those that have been calling for to make sure that we have adequate testing and monitoring specifically for our seniors and the staff that help care for them in our facilities. And we've not been able to get there yet with the governor and his administration. We're going to keep working on that. I know that it's important. And I've been urging the administration that we have to find a way to allow for families to be able to see and visit with their loved ones that are in these care facilities. I've heard too many stories from so many in my district and around the state that have been in isolation for a number of months, that have been unable to see or be able to interact with their family members and their loved ones. And we've been able to come up with creative solutions in just about every other area so far. We've got to find a way to do it here for our seniors and making sure that they stay safe in their facilities, but not leave them in complete isolation from their family members and loved ones. Your question, you asked a question on addressing staffing challenges and how we can try to fix that next session. And that's definitely going to be something I will help look at. We will be able to improve that if we make sure that we keep our priorities straight at the state of Minnesota when we're putting a budget together. And our budget's going to face challenges next year. We're likely going to face a sizable deficit from COVID-19 and the impact that the shutdown has had on this economy. So we're going to have some difficult choices to make, and we need to make sure that we prioritize the people and the care that they need, especially in the Health and Human Services Division, especially for our seniors and those in assisted living. They have to be protected and get the adequate resources that they need in the budget, the tough decisions with the budget that are going to be coming on. So I've already started asking state agencies, you need to help us find things, find programs, find staffing in all the staff that agencies have hired. We've got to find ways to what we can do without in the short term, so that we can have the resources that we need for staffing for our seniors, for funding for the care that they require. So I'm going to be there. If my district chooses to send me back to St. Paul, I will be there to focus on making sure that our budget priorities are in line, that we have people first, and we have programs and government agencies that there are resources allowed. And the same is true with the wages for the staff. I know this has been an issue for a number of years, and I know that having sufficient wages is greatly important, will help with the training, the recruitment, the growth that we're seeing in this area, the number of people that are needed to help work at and serve seniors in these facilities. And I think that because of some misplaced priorities, we've not been able to have the budget and the resources to get those funding increases in the past. So I'm going to be pushing for that, make sure that our budget priorities are in the proper order, that we meet needs that are greatest, and our care facilities are definitely important topics at the top of that list. So I think that's about all with these 4 questions. Unfortunately, I'm going to have to sign off here very shortly, be able to catch my next meeting that's going on here. But I wanted to say thank you so much, Kris, for your work in this area. I know that you've been heavily involved the last couple of years. We've gotten a great amount of work done. We still have more work to do. We have more challenges laying ahead. And if any of you want to reach out to me with questions, I'm happy to have a phone call, an email, whatever you'd like to do to be able to communicate here in the future. So thank you so much, Kris, for having me, and thanks for sponsoring this event.
Thanks so much, Senator. And I will send contact information for each of you to the participants here today to be helpful to the others. Our next person is Brent Kris. He is running against Senator Matthews in Senate District 15. Brent, go ahead. The floor is yours.
Thank you. Hi, everyone. Thank you for the invite, Kris and the Elder Voice Advocates. I really appreciate this opportunity, and I look forward to learning more about your issues that are affecting all of you. And I'd like to thank Senator Matthews for attending this forum and all the other representatives and candidates. I am Brent Kris. I was raised on my family farm in Bogus Brook Township, just east of Malacca. Where I grew up on a farm, I would take care of the cows and the pigs and the horses. I would spend my spring times picking rock and planting crops, and I'd bale hay all summer long. And I still live on the family farm today, just across the road from my senior parents. I attended Malacca public schools, and I earned an associate in science degree over at Anoka Ramsey on the Cambridge campus. I've been employed by BNSF Railway for 16 years and counting now. I've been a union officer for the Sheet Metal Air Rail Transportation Union for the last 12 years. As a union officer, I've worked very hard for my members to improve their jobs, and I will use those experiences and my common sense to help improve our lives in Senate District 15. And I really want to change this us versus them two-party system and get back to fighting for the issues that help all of our residents in our district. And that's why I'm running as a DFL candidate. Plus, I also have libertarian ideas when it comes to people's personal freedoms. I'm personally working hard for healthcare for everyone, good jobs with good pay, strong family farms, vibrant towns and communities, and excellent public education. But I also want less regulations on cannabis, and I fully support our Second Amendment rights. And I want to serve all of Senate District 15, not one side or the other. And I welcome all ideas from every part of our district. I don't seek to be a showboat or grow some statewide profile that furthers my ambitions. Instead, I want to be laser focused on representing you all in St. Paul and addressing the unique needs of District 15. Let's see, the first question was improving care in senior living facilities. I think we all need to band together and work hard fighting off COVID-19. And that's why I support these COVID-19 protection bills that would immediately help our most vulnerable citizens in Minnesota. Senator Scott Dibble introduced this legislation in all 3 special sessions. And I would encourage all the representatives and candidates today's forum to do the same. We need to all band together to fight this disease and save Minnesota lives. Also, with advancements in technologies, we could greatly improve our seniors' experiences in these senior living facilities. Nowadays, we have so many different devices that can track activities, but there's devices that measure blood oxygen levels, take ECGs, and have improved tracking so we can improve wandering management. Beds have fall protection sensors, and there are many other tools to help seniors have a more personalized care management program while increasing residents' independence. That's why I support the Senator John Marty's bill, the Minnesota Health Plan, which would cover all these medical related expenses and many other of our expenses in our senior living facilities. And no longer would families lose their homes or lose their farms because of the cost of these facilities. See, the next question was reducing abuse, neglect, and I'm horrified. It's disgusting that this happens. And I was reading an article the other day how often this happens. They're saying 1 in 10 of our seniors are abused. I mean, that's 10%. That's unacceptable. I understand not all abuse is physical. There's an emotional and mental abuse. And many of our seniors are financially extorted. I don't support the Minnesota Department of Health request to delay the Elder Care and Vulnerable Protections Act licensing. That's supposed to go into effect next year in August, and they want to push it back to 2022. I understand the MDH is overwhelmed with COVID-19, but we must protect our most vulnerable citizens who can't afford any delays. We must increase these protections and services for our elderly. And we have an ever growing senior population. And I think we want all of them to have these precious years with dignity. And they need our bipartisan support to do this. See, the next question was staffing challenges. I support the essential caregiver designation for visitors, so our seniors are not so isolated. And I really do believe in Senator John Marty's Minnesota Health Plan. It would pay the medical costs for our seniors who choose to have home care, or they choose an assisted living facility, or if they need a fully skilled nursing facility. I also feel unions would be able to negotiate staffing changes with the Minnesota Health Board. And since all Minnesota care would not be tied to a person's employer, someone may wish to work with seniors, but they can't because their current health insurance has tied them to an employer they're not happy with. So they can't leave that job because they'll lose that. Then jobs are going to have other incentives to hire employees instead of their insurance plan. And I really think there's quite a few people out there who would choose to work with seniors. Let's see, providing a living wage for our staffers, absolutely support increasing in staffing wages. I believe unions like the SEIU, that's the Service Employees International Union, they would help members achieve this goal. I've personally been a union member for almost half my life. The best jobs I've had was safer working conditions, good pay, decent benefit packages, have all been at union shops. One of the reasons I sought unemployment with BNSF Railway was I looked into the union first. I've also enjoyed being a union officer for the last 12 years in county. I feel great satisfaction when I help one of my union brothers or sisters. We've made their work areas safer, and I've helped with any other issues they've had. I crave that, helping people. And honestly, I can't wait to feel the rush of passing a bill that I know is going to do a lot of good for Senate District 15. And I think probably one of the greatest achievements I may ever have in my life would be passing the Minnesota Health Plan in Minnesota. I encourage you all to look it up. It is Senate File 1125 in this year's legislation. It's a very straightforward bill. It's only 30 pages long. I can't imagine how great it would be for all of us. And for me personally, if we got that passed, how one piece of legislation, it would just be the ultimate achievement in my career. And just want to thank everyone again for inviting me to this. And I appreciate you all for listening, and let's get to work. Thank you.
Thanks so much, Brent. I appreciate that. Let's now move on to Senator Jerry Ralph in that Senate District 14. Senator, the floor is yours.
Well, thank you, Christine. First of all, I want to shout out to you for the work you've been doing the last couple of years. We've had some communications, and it's always been wonderful to work with you and with the other people, the other elder advocates. Sean Burke, for one, has been just an incredible person to work with. He was very instrumental in getting together the elder protection bill that I worked on. Just a few things about me. For most of my life, I've been in the private sector. I was everything from a corporate America. I'm a Marine, former Marine, Vietnam veteran. I went to law school, and I was a lawyer for over 30 years. I was an adjunct professor at St. Cloud State for almost 9 years. Was a small business owner. And through that time, I've, always had the opportunity to put back in the community, serving on many volunteer boards and various organizations. And in 2015, decided that I would try a little different tack to put back into the community, and that's why I became a senator. It is very important to be able to look at something you've done and see how it's helped people. I think that the sum of that is that I've had the experience, real life experience over the years that I've lived, and also have the education to be able to make it work. So the thing that I wanted to kind of stress is I've always felt as a society that we have an obligation to protect the vulnerable. That's something I was very fortunate when I was assigned committees to be made the vice chair of the Family Care and Aging Committee in the Senate, and also to sit on the Human Services Reform Committee. Those two committees touch much of the lives of the vulnerable populations, including the elderly, the disabled, the very young, and those that are less fortunate. So I've worked hard in that area. I will indicate that I received to me personally, a very, very wonderful honor from the National Alliance on Mental Illness as the Legislator of the Year this year, in working with these vulnerable populations. Some of the things that I've done is work on causes of reimbursement for telemedicine in the mental health area. Worked on, even in the special session, retention grants for the mental health providers and day training and habilitation. More importantly, we've referred to the elder abuse, I call it the elder abuse bill. Several of the key provisions, in fact, a couple of the ones that were just mentioned here earlier, were bills that I originally introduced in 2017. Those included the placement of cameras in the residence rooms, and the many difficulties that we had to overcome in order to be able to do that. Part of that was facilitated by the fact that I sit on the Judiciary Committee and was able to work with the data privacy issues that arose over those cameras. The other thing is the Patient's Bill of Rights, and trying to balance the needs of those residents to be able to be protected from unfortunate or unlawful determinations of their leases or of their residencies. So that's something that I think that I've worked on, and this kind of touches on the first question, improving the care in senior living. I think that's a general question that really, as we go through the other more specific questions, I think will address itself. But I think that One of the things that we sought to do, and in the negotiations leading up to this protection bill, was to make sure that we balanced the idea that we have to protect our seniors, but we also have to provide an environment that allows the providers to be able to compensate their employees and also pay for their operations. These providers don't make a lot of money in these projects. And so we have to be very careful of how we balance that. And we worked hard to build that type of a relationship in putting that licensure bill together, all of the provisions to try and bring in unlicensed facilities. I think was a marvelous effort by the task force that grew out of the original elder bill that we tried to pass in 2017. And again, I want to shout out to Elder Voices, Elder Justice, and many of the other advocates that worked hard on that task force to come up with the licensure provisions and the other things that were actually in the final bill that was passed last year. I think the thing that I'm really concerned about, and one of the things that absolutely amazed me in virtually one of the first hearings in our Family Care and Aging Committee, was the Department of Health when they talked about the backlog of elder abuse complaints and how we needed to address that. Now, I do have to give the department, both the Department of Human Services and the Department of Health, a great deal of kudos for the fact that they realized their problem and they've started to attack it. I think they have a long ways to go, but they've implemented a case management system that replaced literally a stack of paper in the desk of the Office of Healthcare Facilities Complaints. So that's a huge move forward. I think that some of the other legislation that we are working on, again, the use of cameras, I think is a marvelous idea. We had to overcome what happens to that data, especially if it's going to be used in some kind of a disciplinary proceeding. We worked through the judiciary to work on that. The Patient's Bill of Rights, as I mentioned, that's something that I think is very important because it does establish standards for termination of a resident's tenancy. It does establish notices about things that are in the bills. It prevents aleatory contracts from being forced down people's throats so that they have to accept it, take it or leave it. I want to say that what we have to do is continue to monitor how this particular piece of legislation is being responded to by the agencies. And being on both of those committees, the Human Services and the Family Care and Aging, puts me in a position where I will be working with and watching the various activities of the agencies in trying to implement these provisions. I also want to focus on another thing that I think is, and you mentioned the term here, and it's very good that you have it in there, and that's exploitation. We have passed legislation 2 years in a row now that has expanded the ability of financial institutions, financial planners, wealth management companies, banks, to be able to put a temporary freeze on a large withdrawal from someone's account if they are in this protected class of elders. This has provided a bit of a backstop to prevent scammers and other people from literally taking people's life savings. This is something we will continue to monitor and work on. It's something that I worked on and will continue to do that. And I think this is something that is extremely important in terms of protecting our vulnerable populations. I want to talk a bit about staffing challenges. Early on in 2017, I worked with several of the care provider and emergency networks to look at how we can increase the number of people that are in the healthcare area that are providing levels of services everywhere from the highly skilled nurses all the way down to the CNAs, who basically are on the ground. They're the foot soldiers. They're working with people. We looked at how to improve home and community-based services because we've found, and I think everyone that's involved in this will agree, that the longer a person can remain in their home and be independent, the better the quality of their lifestyle. And so I've worked with many care providers to try and improve and expand upon those community-based services. I think that's an important thing that we need to continue to look at. In terms of staffing, the problem is, of course, low wages. When you have someone that can make more flipping burgers than they can taking care of someone with a disability, we have a problem. And I have worked constantly and will continue to work on new rate frameworks for reimbursement of these providers so that they are able to pay their employees more. The problem is that the way the formulas work between DHS, the federal waiver programs, and the other administrative procedures is that, I'll give you a perfect example. And this goes to the wages, but I want to finish up on the challenges. Last year, the union nurses or union healthcare workers received $1.25 an hour increase, which was good. They needed it. The problem was the providers that hired them and put them in the various places where they were working only got 70 cents. Something's wrong with that picture. So I've been working with the department to find out why that funding formula did not adequately compensate the provider to cover the much deserved wage increase that especially the low end workers received. More importantly, what we need to do is we need to find a way to encourage people to come into this healthcare area. One of the things that I have been working on is to try and change the licensure provisions. And I've been working with the Board of Nursing and a task force to try and address the issue of how do we get our skilled providers to work at their highest level of skill, not their lowest. And this is an admitted problem because of the shortages of staff. We want nurses to be working as nurses, not as CNAs. How do we do that? We want to work on provisions that allow EMTs or, for example, former military medical service providers, corpsmen, that sort of thing, to be able to use that experience as part of their qualifications to be able to obtain licensure in their field. We're working with the technical and community colleges and the universities. There's two problems out there. First of all, the number of nursing seats in the universities is totally inadequate to be able to meet the upcoming need in the nursing field. We are going to have a tremendous number of retirements in the next few years and could see as high as a $10,000 or 10,000 person per year shortfall in the actual number of skilled nurses that we train in this state. Right now, we have capacity for about 6,000. 2,000 of them either leave the state or never take up the nursing profession. We're not going to make up 10,000 sites a year with 6,000 seats. So we have to work with the universities to try and help them provide more nurses training. But more importantly, I want to work with the technical colleges and with the high schools to try and get students interested in going into the healthcare area. We have job fairs and trainings at the high schools and at the technical college, nursing summer camps to get people interested in working in this area. We want to build a healthcare ladder that allows someone to say, take their CNA training, which is a relatively short period of time, and then be able to go out and get a job that does pay them enough so that they can go forward. And as they go forward, to be able to simply build upon that training, if they want to then become a personal care attendant, or if they want to become an LPN, or go into some other more skilled level, that they can do this in a stepwise fashion. And I'm working to try and build that kind of a program to try and address this staffing challenge. It is going to be a challenge. We do definitely have to increase the money that's paid to the lower end workers. And hopefully that will be something that we can do. Unfortunately, the realities of the budget crunch that we're facing are going to make this a very heavy lift. I have been working for the last 3 years to try and, as I said, get the PCA rate framework changed. I will continue to do that. I think it's critical. So that, I think, addresses much of the, and I think I'm about out of time, many of the things that I'm trying to do in terms of all of this. And this is actually kind of, these questions are all integrated. They all fit into this, into a really almost a single basket that we have to approach from many different areas. I hope to be reelected, and I hope to be able to work with you, Christine, and with some of the other provider organizations to try and seriously improve the issue that we have here so that our seniors and vulnerable populations are well provided for. Thank you very much. And any questions that you have, I will certainly be glad to do that. I see one point here, the ratio between health aide and 1 aide to 11 patients. I would love to lower that ratio. My problem is we've got to get people there to do that. The care providers are unable to hire enough people. I have one care provider that in 2018 had almost 300,000 hours of authorized care that they couldn't get staff to fill. This is the problem that we have. So it's something we will need to work on. Thank you very much.
Thank you, Senator. And you're right. All of these areas are intertwined and impact each other. I'll move on now to Eric Putnam. And Eric, unmute yourself and the floor is yours.
Well, thanks, Kris, and thanks everyone for being here today. It's great to have an opportunity to talk about an issue that I care a great deal about. Now, for those of you who don't know me, I'm running for State Senate in District 14, which is the greater St. Cloud area, basically. It's St. Cloud, St. Augusta, Waite Park, Haven Minden Township. Although I'm not by vocation a politician or a bureaucrat, I'm a teacher. I've taught 2nd grade, 6th grade, high school, and 5 different kinds of colleges. That's my vocation. That's who I am, is I'm a teacher. And when you're a teacher, you have to be optimistic. You have to think that whatever you've done, whenever you're in a classroom, there's something you can do to make things better for other people. And that's a key part of why I became involved in politics. I was never really all that invested in electoral politics until 2016, when a friend of mine asked me to run for office. And I found that when you run for office right, with integrity, which is not something that we see very frequently nowadays, unfortunately, you build relationships with people in the community. And those relationships evolve into deeper understandings of the issues and what's truly at stake. And for me, elder care is one of those fundamental issues, not just because of the relationships I've built with people in our community talking about these issues, but also because of Rachel, my mother-in-law. A couple years ago, my mother-in-law and father-in-law, they were living in rural Maine in a small house in the middle of the woods. We knew that Lori's dad had been struggling physically. He was a welder for 20 years and then a truck driver for 20 years. He'd had a series of failed back surgeries and was functionally non-ambulatory. Lori's mother, Rachel, we could tell in the phone call conversations that we had and the visits that we had that perhaps things weren't working as well for her as they used to. But we didn't really know what was going on. But there was something about her that was different. Then we started noticing that she was losing weight. She was 5'7" and under 100 pounds. And so we had to see what was going on. We asked her to come out and visit with us. And I remember this incredibly clear. This moment is indelibly marked on my heart and on my soul. We drove down to the grocery store at Cooper. Coburn's right there. And I'm sitting in the car with Rachel. And she forgot how to open the door to get out of the car. Her dementia was so advanced at that point, completely undiagnosed, was so advanced at that point. And it blew my mind to think that she could walk across the street, she could get in the car, but at that moment, something about her brain chemistry made it so that she couldn't recognize how to open the door. And that's when we realized that she'd been forgetting to eat. And she and my father-in-law had been at home in this house in the middle of the woods in Maine by themselves for years as she deteriorated intellectually and he deteriorated physically. You don't need my resume right now. You need to know my heart. And when it comes to issues of elder care, that's where my heart is. And we think about how many of the legislative advancements that have been made, how much further they would have gone if instead of the bureaucrats we have now, we had actual leaders in office who did not wilt under pressure when faced with an argument from a lobbyist. So now when it comes to the 4 questions that you asked, which I'm seeing as kind of as 3, the first has to do with improving care. Second, reducing abuse. And thirdly, talking about workforce development. Now, when I think about improving care, I had a conversation with a friend of mine a little while back. He's a gerontologist who actually works in assisted living facilities. And he was talking about improving care from the perspective of a medical provider. And one of the things he said is that everyone knows that the medical care that you give to seniors, the less you do, the better. That sometimes we overtreat seniors, and that creates problems that didn't have to be there. He suggested exploring the notion of ISNPs, which is a program that allows people who aren't on medical assistance to actually get involved in managed care. So that instead of having a fee-for-service help while you're in assisted living facilities or while you're seeing your doctors, you have managed care where you have the same doctor, and that doctor will treat you over and over again. And we all know that when your doctor knows your body and knows your health, that doctor is going to not overprescribe, not be too paranoid or too overcautious, but instead is going to know your body and know how to treat it, know how to keep you healthier. Those kinds of relationships are how you improve care, specifically in the context of providing medical care for our seniors in assisted living facilities and nursing homes and those kinds of environments. But that's not all. I also think of, and CentraCare is actually thinking about going into ISNPs as a program as well. It's something that's actively being considered. And I think that's something that we need to pursue more enthusiastically. I think of just a couple months ago when COVID first hit, I was contacted by Whitney Senior Center. And from when COVID hit until well through the summer, I did lectures at Whitney Senior Center via Zoom. The other way you improve care is you increase relationships for sociality between the community and elder care spaces. So I gave a lecture on Greek philosophy. I talked about the history of democracy. I even did a day on art, which I was thankful for their low expectations that particular day. But when I tell people that I was doing this, I did all these lectures via Zoom over the summer and in the spring during the context of COVID. I think, why weren't we doing that before? Why didn't we have people from our community develop a program where we had more of those kinds of interactions to improve the quality of life? When you talk about the improvement of care, we're talking about the improvement of quality of life, first and last. And those kinds of interactions are interactions that bring added value to those environments. The seniors that I talked to in those lectures really enjoyed the time. And we had great conversations with each other. Because it was COVID, some of us were in different spaces, but we still got to come together as a community over something that was meaningful to us. That is something that we need to develop programmatically. I talked to other teachers, other people in the community. They say, hey, that sounds really fun. Can I do that too? I didn't even know that was an option. That's something that can improve the quality of life. And in my perspective, that means improve the quality of care in the context of congregated living and assisted living facilities. Now, when it comes to reducing abuse, I gotta say I agree with Senator Matthews when I say that the provisions that have been passed recently are small and just a first step. We need to realize that also the process that's going to deal with these provisions that have already been established can very easily weaken them unless we have actual leaders in the legislature instead of bureaucrats. So some of the provisions that we've got have been very helpful. And I applaud those efforts, but I'm nervous that they won't be implemented the way they should be. And I would oppose postponing the licensing of assisted living. That's been a problem for a very long time. For the longest time, Minnesota was the only state in the entire country that didn't license assisted living. So it's too late. We should have done that a while ago. So let's do it sooner than later. Now, when we think about workforce development, I'm going a little bit quick because I think we're going to run out of time. When we think about workforce development, when I was in high school, I was actually a waiter in an assisted living facility for $4 an hour and 3 days. That was a hard job. I agree with Jerry in a sense that wages are important, but again, the bigger issue is quality of life. When we think about the workforce in these places, these are hard jobs. So many of the issues of abuse can be traced back to the fact that the job is so incredibly difficult and that people are struggling who are doing those jobs. I don't believe that anyone gets up early in the morning and decides to do something horrible and mean to somebody else. I think that there are circumstances that put us in positions where we make bad decisions. And so it's our job as legislators and as public servants to make sure that people are in those kinds of bad circumstances as rarely as possible. So yeah, we do need to increase wages, but we also need to increase the quality of the job, which means being much more thoughtful and strategic about the way that we regulate employees. Yes, we absolutely have to have regulations for employees to make sure that they take care of the people that we care about. And we do need to lower staffing ratios, but not just in elder care, but in all care, in child care as well. We need to reconceptualize what we mean when we talk about regulations. I had long conversations at a child care facility a year or two ago. And they talked a little bit about how they don't mind all the paperwork. They just want some help filling it out. That right now, regulations and oversight and accountability is done punitively instead of as an effort to help people give better care. So we need to reconceptualize the way that we do accountability in that context so that people understand that they're not there just automatically to be punished, but that there's a point behind regulations to help people do their jobs better and to help people take care of each other better. I also would like to see education benefits to help people understand that working in healthcare and this kind of care in general can be a career and not just a job. It can be fulfilling, not just in this industry, but in all industries right now. I think that we are culturally at a crossroads where we are continuing to mistake wealth for worth, inheritance for excellence. We need to appreciate labor for what it is and start investing and thinking about work. And that is not about lowering expectations. That is not about saying people don't need training to do the job because they've got experience doing the job. That's the opposite of the respect for work and the actual trades. We've seen what that did in education. So I think instead of expecting less from people, we expect more and we help them get there. And when I think of the seniors that I know, I think that they would appreciate that commitment to their care. When I think of my mother-in-law, who now, partially because of conversations with you, Kris, she actually lived with us for a couple months. And I tried to take care of her for that time, because for those of you who don't know, my wife, Lori, is the assistant superintendent of public schools in 742, and she's awfully busy and awfully good at what she does. So I took care of her for most of that summer, and that was hard work. When I think of her, and we were thinking about what we could do with her, I thought about you, Kris, and I thought about the conversations we've had about elder care. And we held on to her for a little while until a space opened in a memory care unit in Pennsylvania where my sister-in-law is a nurse. Because of how concerned we were about the kind of care Rachel would get, we held out until we could get her into that facility. And we got lucky because right across the street's another assisted living facility. That's where Lori's dad is now. We got lucky. But the time to rely on luck for policy is long past. The stakes are too high. We need intention and we need leadership. And that's why I'm running to represent District 14 in the Senate.
Thank you, Eric. Very good. And thank you, all of you, for very thoughtful comments and your points of view. Senator Ralph did address the one question, and I'll let our other two candidates respond to Ramona's question about staff ratios. And I know, Eric, you did touch on that. And Ramona's asking, would you lower the ratio between patient and health aide? And what do you think that ratio should be? Eric, you're
Sure.
live yet, so I'll let you go ahead and do that.
That's the greatest praise I've gotten in a long time. Eric, you're live. Honestly, I told you before, I'm not a bureaucrat or a politician, so I'm going to do something that people don't often do in that context and say, I don't know. I don't know what that ratio should be, but I know it's too high as it is. I think humility is a very important part of being involved in politics, as is curiosity. And so I don't know what the ideal ratio would be, but I do know that we need more people taking care of our people, or they're not going to get the care they need. So yes, I would absolutely support augmentation of that ratio, but just to be honest and to be humble, I can't tell you what that number would be because I just don't know.
Well, we might have some ideas to share on that subject with you. Brent, I'll let you respond, and then if Senator Ralph after that has any additional thoughts. Brent, go ahead.
Again, yeah, thank you. I'm with Eric there. I don't know what the proper ratio will be. I know a couple weeks ago, I talked to a lady whose mother is in a senior facility, and they're not able to visit all the time, but she was able to, I think they were Skyping or something on the phone, and her food was over on the tray on the other side of the table, and she couldn't get up to get her food because they're so strung out. There's not enough people there to sit and feed her mother, which that was something she would do a lot of times when she was able to come in. So I would talk with the experts and see what the proper ratio would be, but I definitely, if it's 11, it's way too high right now. So, but yes, I would need to learn more on what it should be.
Okay, Senator Ralph, anything more you want to add on that?
Yeah, just a couple of things. First of all, I mean, absolutely, we need to, as I indicated earlier, we need to change that staffing ratio. I also don't know. I think that we have to do one thing that we have to distinguish here, and that is to remember that legislators, our job is to investigate, follow the committee process so that we get a good bill, and then put the bill together, and then the agencies are the ones that are charged. That's the executive branch, are charged with putting this stuff into practice. And as a legislator, we can do oversight and we hold hearings. And in fact, that we do that to try and keep track of what's going on. But I think what we have to remember is that leadership is finding creative solutions to problems. And that is something that as a legislator, I've tried to do. And I do want to touch on one thing that I think has been mentioned, and I agree with Senator Matthews. I agree with Eric Putnam that we should not postpone, and that the agency is dragging their heels on putting this thing together. In fact, at a hearing here not that long ago, I actually espoused that very position and asked the commissioner, why do you want this? And their answer was, well, we're not ready to implement it. And I said, why not? You've known this has been coming for almost 2 years. And so I think that that's what we have to do with the agencies is to try and hold them accountable. That's where we can make an impact. And God bless, there are a lot of very hardworking people in those agencies. Even the commissioners who sometimes get maligned because of things not going on, they're dedicated to what they're trying to do. I've worked with Commissioner Malcolm. I've worked with Commissioner of Human Services. They're dedicated people. Sometimes they get just caught up in what I call not institutional memory, but basically the institutional concrete block that is very hard to change as you go forward. And that's something that I think as a legislator and as a group as a whole, we can agree on and get together and try. And I do work across the aisle with the people. I have to shout out to people like John Hoffman and former Senator Laurie for truly taking me under their wing when I came into the legislature and was put on human services, not knowing what a waiver was from a brick wall. And they basically were very good to me. And I built those relationships because that's what legislation is about, is building relationships. So anyway, I went on a little bit at length there, but I think it's important to understand exactly what the role is there. And I think it's to be creative.
Thank you, Senator. I'll ask Sandy Clocker, I believe wants to make a comment.
Yes, I'm sorry. I think my chat is not working, or I might be blocked. But I would like to ask Senator Ralph how the residents are going to vote in the facilities with them being locked up and the family being locked out. How are we going to know that there will be a process where they can vote and it will be a secured vote? Thank you.
I would like to comment on that in general. First of all, I think that the Secretary of State is trying to get this work to get this election run fairly. There's a lot of issues that we're seeing, but I think one of the things to remember about Minnesota is that it has one of the best absentee voting systems in the country. When it's allowed to function, it works well. You have to request a ballot, you get the ballot, you fill it out, and you send it back in, and it's all secure. I think in the facilities that if they are not providing opportunities for these ballots to be delivered to the seniors that are in isolation, especially because of COVID, then we need to address that and we need to know about that. And I think the facilities and the people there need to speak up. And I hope they do. I hope the provider agencies are working on this. In fact, I've made a note now on that to kind of look into that. I think you raise a very important question. And so I, in my position, will definitely be asking that question. And I think that that's something that should be addressed to the Secretary of State because he's the elections, he is who runs the elections.
Thank you, Senator. And I'll let Eric and Brent also respond if they wish.
Sure. There are a few things more sacred, more profound, more necessary than the right to vote. And not just the right to vote, but to have your vote actually submitted and counted and meaningful. So what I'd like to see, Steve Simon has done a phenomenal job as Secretary of State. And in fact, in 2018, 1/4 of all the votes cast were cast absentee. What I think we need to do is to actually have some real outreach to those actual facilities and make sure that the people who are working there are helping do a little bit of civic education so that folks know not just that they have to vote or can vote, but also what issues are most important outside those facilities. I talked to someone on the phone. I'm not door knocking right now. I think it would be disrespectful. So instead, I'm making lots of phone calls. And I talked to someone in a facility just a couple weeks ago about her vote. And we had a phenomenal conversation. That's the kind of outreach that needs to occur actually within campaigns as well, to focus on populations like that and make those phone calls. We sent a bunch of letters. We sent 3,000 letters to seniors throughout the district to tell them to call us if they have questions about things. And a lot of those went to people in facilities. So there's a responsibility of the governance, there's a responsibility of those people who are working in those facilities, but there's also the responsibility of the campaigns to be creative and thoughtful and find new ways to reach people where they are, especially when living in isolation in that way.
Thank you, Eric. Brent?
Yeah, both have said great, given great information. It is up to the Secretary of State, but as I had mentioned before about the essential caregiver designation for some visitors, because not only do seniors need help in getting a ballot and doing that, but a lot of seniors need help filling out the ballot. So they like a family member to be able to come in and help them fill out that ballot. And I understand there's a risk to this, but a lot of people are willing to take this risk right now. We can wear masks, we can try to socially distance as much as possible, but our seniors should be allowed to vote. And yeah, so I would propose that we work hard on doing that.
Thank you, Brent. We've almost reached that magic hour and I don't see any other questions, but I thank all of you for participating. Our Senate candidates, thank you very much. And you gave very thoughtful thoughts on all of this. We appreciate it. Elder Voice Family Advocates is going to be looking forward to the next legislative session. As some of you have pointed out, there are a number of areas that need to be addressed, and we'll be knocking on your doors and appreciate the willingness to let our folks know how you feel, what your points of view are. And thank you, everybody, for participating. I'll get follow-up contact information out to everybody. And remind you again, go ahead, forward people to come listen. I think this was a terrific discussion we had today. And I hope that a lot of Central Minnesota citizens get the chance to view this. So please pass it around. It'll be on our website. And take advantage of it. With that, thank you very much, all of you, and have a wonderful day and stay healthy.
Thanks,
Thank you
everybody.
very much, Christine.
Thank you. Bye-bye.
Bye.